Prime Minister is in intensive care. He's on oxygen, but not on a respirator. There's a big difference. If you go on a respirator, you have to be sedated, and then the respirator takes over your breathing functions. He's on oxygen, so he has a mask, and that helps ease the strain of breathing, which I think was a problem the other day, which is why he was taken to hospital. And at the moment, I understand his condition is stable. He's had a couple of good nights. The good news is there's no worsening of his condition. And I did hear, although waiting to hear it confirmed, that he hasn't got pneumonia, which is one of the other great dangers. So he's stable, which is good news. And I believe he will recover. He's a tough guy, a fighter, and we're all willing him on because he's a good friend of mine.
Much has been said about the line of succession, but I don't want to dwell on that too much. What I do want to ask you is why we seem to be so far behind other countries in the UK on the issues of testing, PPE supply, and actually having a plan for coming out of this crisis.
Well, we're not actually behind other countries. The tracking of the UK is a couple of weeks behind where Italy, France are, etc. And the reality is that there are different countries have different capacities when we came into this. Germany, for example, has a very big industrial system on diagnostics. They're very big in the private sector on diagnostics. So going to testing, they've been able to test many, many more than most other countries because of this base in diagnostics. In the UK, we have not had a strong base in diagnostics. Our scientific experience is elsewhere. So they're building up that diagnostic capability, and they are now targeting 100,000 tests, and that's really where they're working up to, and all the labs are on that at the moment, and they're building that facility. So, yes, we'd love to be able to have tested more, but the critical thing is, A, to get the testing kits, and many of these testing kits they've got from overseas have not worked, so they're having to build them inside the UK to be certain that they work. So that's the critical issue, but I understand it's building well. I also understand in the UK from scientific advisors that the relevant good news, and we're not overplaying it, is that the number of cases reporting has actually beginning to flatten out, which will have a knock-on in due course, hopefully, for those numbers that die.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.